Well, away from that, let's get into the health sector. And the tuberculosis community wants government to provide necessary resources to restore the enablers package for persons suffering from tuberculosis. Speaking at the 2022 World TB Day on the theme, Invest to End TB, Save Lives, National Secretary for TB Voice Network, Jerry Labi, said persons living with the disease need nutritional support to enable them take their medication. There is more in this report.
The attempt to end the number of people dying from tuberculosis every year, TB Voice Network is urging government to assist the community to refurbish the enablers package, which makes it possible for TB patients to have free access to food. According to the National Secretary for TB Voice Network, Jerry Labi, the enablers package has been stripped off due to the lack of resources and is therefore calling on the government to have it restored, as the majority of the patients are unable to afford a two-course meal.
It is time for us to invest in TB to save life, because there is a lot that the community members are going through, especially persons who have been infected and affected by the disease. There used to be what we call the enablers package, where we support TB patients with some nutrition to enable them take their medications. Because of lack of resources, this has been taken out, and it's really causing a lot of issues within the community members, because it is not easy for a person to take different antibiotics for good 6 months on a daily basis. We ask ourselves, even our own malaria antibiotics, are we able to adhere to it for the 3 days or 5 days? And how much more are we taking combinations of antibiotics for good 6 months or more than that on empty stomach? This is something that I'm calling on the government to support and make sure that we bring back this nutrition to support our own people.
On the other hand, a member of the National Executive Board of Stop TB Partnership, David Kwesi, is calling on the government to allocate resources to support the National TB Control Program by providing 1 million cartridges to agencies fighting tuberculosis.
We are calling on the President to come in to help the ministry with the political will of allocating resources to meet the gaps. If he allocates a resource, he's saving a life. We need him to ensure that, like the WHO countries have said, we are not only fulfilling our parts of the counterpart financing arrangement with the Global Fund, but we are also raising other resources to invest in especially community activities, because that is where there is collection of sputum from hard to reach communities. That is where accessibility is breached, or inaccessibility is breached. That is where cutting down of catastrophic costs, which is a burden on people in Ghana who die of TB. That is where we cut it, because the civil societies are able to go to collect sputum to transport, rather than asking people to travel and spend their own money to assess TB screening. So having said this, we wish to call on the President for a birthday gift. Honorable Minister, maybe I say this on your behalf, that the President will support the ministry with 1 million cartridges as a birthday gift to the World TB Day celebration today, 24th of March, 2022.
Meanwhile, tuberculosis remains a public threat in Ghana. Though COVID-19 is the leading cause of death globally, in Ghana, tuberculosis is still the leading cause of death, killing about 15,000 Ghanaians each year. Director General of Ghana Health Service, Dr. Patrick Kumar-Boaje, says his outfit is set to roll out some strategic interventions across the country to contain the disease.
I have, as part of improving our service response indicators, signed a performance contract with our regional directors to roll out strategic interventions to find the missing TB cases, as was mentioned, nationwide, and manage our patients to ensure better treatment outcomes using strategies such as sputum transportation system, particularly that enables about 1,000 health facilities without on-site diagnostic capability to access gene expert testing cases across the country.
To help in enhancing the prevention of disease, the National Tuberculosis Control Program has implemented a new strategy called the TB Preventive Treatment, which would help in early detection of the disease. Mausi Nomon's report for JoyNews.